I can do. Okay, Pankaj, sure. Okay. So for the video session, okay, you will be having 9 minutes. Out of that, 3 minutes is meant for the watching the video. How many times you want to see? Okay, you can see that actually. After the discussion will start, which will last for the 6 minutes. Total, you have 9 minutes. Okay. So okay. So time starts now. Is it okay? Pankaj, you want to see it again?
Yeah, yes, sir. Once more.
Okay.
The video is.
Okay.
Okay.
So could you
Yes.
could you
So
please summarize your findings seen in the video and tell the diagnosis?
yeah. So I can see. A newborn, probably less than 2 weeks. Newborn who looks pink and is looking well grown for his age. But I would like to plot on appropriate chart. Baby is in nappy and umbilical cord is attached, looking healthy. Child is sleeping and is having flexed posture, but at occasion there is jerky movements of all four limbs, and setup is I think it's home setup. So yeah, so this jerky movement which is during sleep. So concluding all this, uh, I feel that this may be either benign sleep myoclonus or jitteriness.
Okay, jitteriness. Any other differential diagnosis for this kind of
The differential diagnosis. Yeah,
moments?
so maybe neonatal seizures, but then the movements would have been more uh, more jerky, more abnormal, and there may be some cyanosis or distress, uh, may be obvious, and other are like startle response, maybe my TD.
Okay, all right. So, what additional history would you like to take in this case?
I would like to take a history about this onset, course, and duration of this. When did it start, and then whether it is associated with any change in color of the body or like um, any pallor or
Okay, go ahead.
bluish discoloration of body. Also like to ask about whether there is any mark in the skin, cutaneous mark, then any preceding prior to that, and whether it is happening when child is awake also, whether it stops while touching the baby, and it's 2 weeks old, so development wise, yeah, like neck holding and those things I can ask.
Okay, so what additional examination would you like to do here?
I would like to check for babies um, airway, breathing, circulation, as and then vitals like oxygen saturation, heart rate, respiratory rate, and hydration status. Then I would like to also check for anterior fontanelle child's movements, means tone and tone power reflexes. Yeah, 180-degree, how is the baby's tone? And I would also like to check for those reflexes like neck holding and pull to sit.
Okay, okay, all right. So how do you manage this child?
So I would like to take I would like to take complete history and detailed examination. I will involve my senior consultant, and I would like to do certain investigations depending on the history and examination, whether it is a benign condition or whether it is uh, seizure, a neonatal seizure. So like sugar, I would like to check child's sugar and electrolytes, especially calcium and magnesium, and and also ultrasound, head ultrasound, and EEG if strong suspicion of uh, seizure disorder. But if it is benign sleep myoclonus, then it won't need any investigation.
Okay.
Jitteriness also will not.
Okay, all right. So mother is very much worried. So doctor, please give some medicine for these abnormal movements. So what is your advice?
So for advice, I think this is occurring during sleep only. If it is occurring during sleep only, then it is very benign condition which will not need any medication. But I will advise her for some red flag signs, like if it happens during awakening, and if it is not stopping with handling the baby, or if it is with the color changes like pallor or bluish discoloration or persistent prolonged movement, abnormal movement, then to consult uh, the hospital urgently.
Okay, all right. So the time is over. So let's do the discussion. Okay, guys, open your cameras. Let's do the discussion. Okay, so Pankaj, how was it? How did you do?
I forgot to ask in history about feeding and all those feeding and activities, but uh, I think I think it was okay, not bad, not very bad.
Yeah, no, you don't have to think like that. Okay, so it is good only. We never felt it is bad. Okay. All right. Okay, guys, would you like to add some comments for his performance?
That sir was very structured. But as sir said, that whether the child was encephalopathic, that was missing. But obviously from the video, the child was active. But in the history, yes, to find it, whether it was seizure, then the perinatal history also.
Yeah, it's a
But this
very
being a,
important. You want
yeah,
to lot of
Yeah,
birth
yeah, yeah,
asphyxia,
yeah.
perinatal asphyxia, man.
Mhm.
Okay, premature perinatal, it's not premature
Yeah,
anyway.
yeah, yeah.
Actually. Okay, so that's perinatal history is very important. Family history also, family social history. Family history of neonatal benign, neonatal seizures. Okay, those things also. Have. Fifth day seizures, benign neonatal seizures. Okay, those things also we have to ask, isn't it?
the video has so much of background noise. So actually, startle reflex would also have been a DD. So
Yeah, that
noisy.
Yeah.
he
Baby is
told
sleeping
exaggerated
so
starter reflex. He
comfortably.
told that actually. He told.
And baby was sleeping very comfortably even.
Which we don't do it, isn't it? So for us, it don't happen like that, isn't it?
Yes.
Okay. Anyone else? Yes, Radhika, you want to say something?
Yes, so I also feel it was very, very structured, very meticulously he's planned it. And yeah, I feel like feeding and although no dysmorphism was seen, that also maybe whether the child looks that
Okay.
part. And head size, if she's noticed any change, anything like that. And lethargy, yeah, any changes, encephalopathy or lethargy.
Yeah. Okay.
Any
All right.
drugs also should we ask, sir?
Yeah, perinatal history, if
Dr-
mother was taking some
drugs, yeah.
drugs, like recreational drugs, especially like, opiates and, withdrawal symptoms, even including alcohol and things like that, you have to ask during pregnancy. Perinatal history is very important. Antenatal, perinatal. Yeah. Okay, so Pankaj, well done. Overall, it was very good, I can say. Yeah. Uh, yeah. So little bit more about the history and things like that, just for the differential diagnosis, that's important. Otherwise, okay, the way you explain the findings, okay, so child is sleeping, looking, well built for the age, like, is probably less than 2 weeks in the home settings. Okay, child is pink, looks comfortable. Yeah. So I could see sudden jerky movements of the limbs. Okay. So flexion movements, uh, probably myoclonic shocks. Okay. So with the background, in the background, some noise coming from the probably parents, someone in the surroundings. Okay. So putting all this together, I'm thinking benign sleep myoclonus. Benign, okay, sleep myoclonus, right? So differential diagnosis you told. Um, One is jitterness, yes, I agree. Okay. It could be just seizure disorder. It's a part of seizure disorder, generalized seizure disorder. Benign neonatal seizure also, fifth day seizures, hyperclepsia. Okay, so exaggerated reflex, started reflex to the sound, so that also we can keep it in mind. Okay. Sometimes you'll have blood imbalance, but not to forget about the maybe some CNS infection, perinatal asphyxia, Sunni-Ricotenius syndrome is also possibility. So you need to think as a whole, like, so that's a thing. Okay. And what additional history would you like to take? So onset, course, progression. That's very, very, okay, important. So when they started, like, course, are they progressive in nature? Okay, so are they happening in the sleep? Are they happening in the daytime? What about activity, feeding? What about the growth of the baby? Okay, so that is affecting. Okay, is there any history of fever, decrease activity? Well, like basically, you want to clot neonatal CNS infection, isn't it? All right, and so any history of drug intake for this child, for these moments, anything they are taking. Okay. Then detailed birth history. Okay. So perinatal history, antenatal, any use of recreational drugs during pregnancy, history of alcohol, other things. Okay. Then any history of delayed cry after birth. Okay. So yeah, then family history of similar complaints in the similar complaints. Yeah. So this is about the Okay, so we're going to ask about the history. Okay, what additional examination would you like to do? Okay, so head-to-toe examination, complete head-to-toe examination. Okay, looking for the neurocutaneous markers. Okay, then I would like to look for the anterior frontal perfusion, vitals. Okay, then detailed neurological examination, including formal vision and hearing assessment. Okay, then so we can say if parents are too much worried, if it is too much, happening frequently, you can actually admit the child. You can do investigation like, blood sugar, calcium, magnesium. I agree with you. Okay, neurosonogram, one easy also could be planned. Take help of the neurologist, right? Because this is benign sleep myoclonus is kind of like, you can say, still you need to do this in this, even though so you want to rule out secondary other causes like the underlying pathological causes for that. Okay, so this is benign condition. For the management, yeah. So once all the investigations are done and if they're normal, then I would like to reassure parents. Okay, and just watch for the child. Okay, and look for the how child is growing in future, like in growth and development. Okay, so anytime if the child is having neurological deficit or any delayed milestones, anything like, then your diagnosis will change, might need some more investigation, isn't it? Like MRI and other things like that. Okay, so otherwise reassurance about the medication. Yeah, if it is benign sleep myoclonus, you don't need to give any, just reassurance. Okay, so giving medications like benzodiazepines or phenobarbital will worsen the underlying conditions. Yeah, but neuroconsultation has to happen. It's better. It's to be on the safer side that you are not missing anything. Okay, as a child grows, it goes away. Okay, so however, I would like to advise you to look for the red, you can say alarming symptoms in the form of, if the baby continues to seize, even if the baby is awake, or if the baby is having decreased activity, feeding, sleepy kind of thing, or if the baby's color changes, if baby goes into, kind of stoppage of the breathing, something like that, then you need to bring the baby back to the hospital immediately. So that is how we have to consider and to do the management. Okay, so any other question, guys? Marianne is there. She's not speaking. How are you, Marianne? How are you doing? Pallavi is there. Okay. Lakshmi is there. Okay.
Sir, I would like to add that in every seizure where we are suspecting the seizure, then we will ask three questions which are must. What happened before, what happened during this moment, and what happened after that moment. These are very important in case of every seizure.
I agree with you, Gulam. Okay. So this is important, and any event, I think, so not only just this episode. So any event you have to ask this. Okay, how was the child before, during, and after? I agree with you. Okay, I think that's fair enough for the day today.